Welcome back, healthy people, to another great episode of On Call with Dr. Randy. We are back, ladies and gentlemen, from Thanksgiving break. I hope you had a good Thanksgiving. I hope you got to eat everything that you wanted to eat. Hopefully by now you've stopped eating apple pie for breakfast or whatever you're eating for breakfast from Thanksgiving that you know you shouldn't have been eating for breakfast. Just because it's apple and it's in pie does not mean that you're starting your day off with having a healthy breakfast. Apple pie does not count as your fruit serving for the day. But welcome back, y'all, for another episode of On Call with Dr. Randy. This week, I'll be discussing cervical cancer screening. Cervical cancer is cancer of the cervix. The cervix is the lower part of the uterus. What's the uterus? The uterus is an organ in a woman's pelvis that sheds once a month when a woman has her cycle, and it's also where a baby sets up shop until it's delivered. There's somebody out there who doesn't know what the uterus is, so I'll make sure to put that in there, keep it real simple for y'all. So if you don't know what the uterus is, now you know. Thanks, Dr. Randy. You're welcome. Let's continue. So the cervix is the bottom part of the uterus. For comparison purposes, you can think of the uterus as a balloon and the opening part of the balloon as the cervix. It is estimated that this year approximately 13,000 people will be diagnosed with cervical cancer, with the highest rates in the Hispanic and African American community. Cervical cancer rates were previously high in the 70s but have improved over time due to Pap Smear Tests. So what's a Pap Smear? A Pap Smear Test is a procedure done to screen for cervical cancer. We're essentially looking for abnormal cells in the cervix. We're trying to see if there are any precancerous cells or cancerous cells when we do a Pap Smear Test, which is basically when a physician swabs the inside of the cervix and gets a sample of those cells. A lot of the recommendations have changed in regard to how often women should have Pap smears and when women should get them. Recommendations previously suggested women would have to get Pap smears every year or when they started to become sexually active. However, in the last few years, these items have changed drastically. So let's discuss these changes. According to the U.S. Preventive Service Task Force, which is an independent volunteer panel of national experts in prevention and evidence-based medicine, which basically means there's a group of researchers who look at research and make recommendations and guidelines. According to this group, women should start having Pap smears starting at age 21 and have it done every 3 years if the results are normal until age 29. So once again, according to this group, the average woman should start having a Pap smear at age 21 and have it done every 3 years if the results are normal until age 29. At age 30 and all the way until age 65, women can get screened for cervical cancer in one of 3 ways. One is a Pap smear every 3 years, so just a swab of your cervical area. Option number 2, you can get tested for HPV every 5 years. HPV is a sexually transmitted virus that increases a woman's risk of developing cancer. That's option 2. The physician does a swab of your cervix and tests you for HPV. Option number 3 is have both a Pap smear and get tested for HPV every 5 years. So that's essentially getting both done, having a swab of your cervix and also getting tested for HPV, which is the virus that's shown to increase a woman's risk of having cervical cancer. Often women get HPV early in life, but are able to clear the infection on their own without treatment. According to the task force, after age 65, or if you've had a hysterectomy and you've never had cervical cancer or high grade, which are really bad precancer cells, you don't need to have a Pap smear. So I'll repeat that for the people in the back who aren't paying attention. So according to this task force, after age 65, or if you've had a hysterectomy and you've never had cervical cancer during your life before you had the hysterectomy, or you've never had really bad, we call them high grade precancerous cells. There's different levels of precancerous cells. You don't need to have a Pap smear. So make sure you talk to your doctor about this. If you've had an abnormal Pap smear in the past, asking your doctor, were my precancerous cells high grade or low grade? Or you can just make it real simple, whether not that bad or really bad. That might be the easiest way to kind of keep it in your head. Many other organizations such as the American College of Obstetricians and Gynecologists and the American Cancer Society agree with those recommendations that I just listed for you all. However, the consensus with these two organizations is that having a Pap smear and being tested for HPV is the best test. And this is done once again every 5 years if the results are normal. So some women may have thought in the past that, oh, I have to get a Pap smear every year. You don't necessarily have to get a Pap smear every year. You can wait 5 years to get another Pap smear if you've never had an abnormal Pap smear and you're over 30 years old. If you're younger than 30, between 21 and 29, you'll have to get it done every 3 years, but you won't have to do the HPV testing. You can have a Pap smear done every year if you want to, because usually insurance will pay for it. But I just wanted to lay some things out for you if you wanted to have other options. However, I know there are some women who would prefer not to have it done every year. The procedure is uncomfortable, a woman may be on her cycle, or for other personal reasons may prefer to have a Pap smear done as less often as possible. One year you just may not feel like having a Pap smear, or maybe you've had a real bad Pap smear in the past that just created some psychological trauma and you don't want to have it done or would prefer another provider to do it. I just want to lay those things out for you so you'll know your options. Now I have to get on my soapbox just a little bit. Let me get your undivided attention. Let me get both of your ears. A lot of women come to see me and don't know when is the last time they had a Pap smear or thought they had one and didn't have it done. I always like to use a car as an example when I'm talking to patients. So I'm going to use a car as an example in this scenario. Let's compare a pelvic exam to a tune-up. Some women go to get a tune-up and think they're getting an oil change, but all the mechanic did was change your air filter. You didn't need an oil change, but it was something else that was needed. What do I mean by that? Sometimes you may have a pelvic exam and they may be swabbing you for a yeast infection or STD, and you may be thinking that they're also doing a Pap smear, but they may not be doing a Pap smear, they're just doing a swab. It may not be time for you to have a Pap smear. So ladies, when you go to get a tune-up, make sure you know what they're doing underneath your hood. Before you have a pelvic exam, ask your doctor what they're going to be doing down there. Before they get started, say, hey, before you pop my hood, what are you going to be doing down there? Am I getting an oil change? The windshield wiper fluid? You checking for leaks? Or, are you going to be swabbing for any bacteria? Or are you going to be doing a Pap smear? That's what you should be asking them. Not if you need an oil change or a windshield wiper fluid. They may be confused and they may try to give you a psychological exam. But I know what you're talking about if you were talking to me, but hopefully I won't be doing your Pap smear. Anyways, I'm back off my soapbox now. So once again, know what's going on underneath your hood. Last time you've had a Pap smear, and if you're at the age for a mammogram, last time you had a mammogram, those type of things will be very helpful. I know there was a good amount of information to take in at one time. I wouldn't be surprised if you didn't remember it all. So don't hesitate to go back and listen to it again. And as usual, I'll summarize everything again at the end of this episode.